A warm good afternoon from India to all. I'm Kashmira Nair, a medical student, and I'm here to present my oral paper. The topic of my presentation is Diagnostic Agreement between Anti-H. pylori, IgG Serology, Rapid Urease Test, and Gastric Histopathology in adults. Okay. In adults with chronic upper gastrointestinal symptoms, a cross-sectional study from southern India. It has been conducted in PRS Hospital Private Limited, Thiruvananthapuram, Kerala. Background: the H. pylori infection remains a major global concern because it is strongly associated with chronic gastritis, peptic ulcer disease, gastric mud lymphoma, and gastric adenocarcinoma. Accurate diagnosis of active infection is therefore essential to guide the treatment and prevent the long-term complications. Several diagnostic modalities are available, including serology, rapid urease test, and histopathology, each with its own advantages and limitations. However, the diagnostic performance can vary in high prevalence population and in patients receiving proton pump inhibitors, making the choice of the most appropriate diagnosis, test, an ongoing clinical challenge. This knowledge provided the rationale of my study. Primary objective was to compare the agreement among the 3-degree diagnostic modalities. Secondary objective included estimating prevalence, evaluating test performances, measuring inter-test agreement, and characterizing the accompanying endoscopic findings. The methodology: comprehensive H. pylori diagnostic workflow. This was a hospital-based cross-sectional observational study conducted in the Department of Medical Gastroenterology at PRS Hospital, Thiruvananthapuram. Over a 2-month period, consecutive adult patient presenting with chronic upper gastrointestinal symptoms lasting for more than 4 weeks and undergoing diagnostic upper GI endoscopy with gastric biopsy were enrolled in the study. Characteristics and findings: a total number of 219 patients were included in the study with a mean age of 50 years and a male predominance of 64.8%. Histopathology identified H. pylori infection in 53.9% of the patient, while rapid urease test positivity was 53%. In contrast, anti-H. pylori IgG serology was positive in 36.5% of the participants. The most common endoscopic finding were antral gastritis and antral erosions, whereas only 2.7 had a normal endoscopic examination. The diagnostic performances of RUT and IgG serology. When compared with histopathology, the rapid urease test demonstrated greater sensitivity, dictating nearly 2/3 of the histopathology positive cases. In contrast, IgG serology exhibited higher specificity and positive predictive values. Despite these differences, the overall diagnostic accuracy for both the tests was similar, approximately 61%. Cohen's kappa values indicated only fair agreement with the histopathology for both the modalities, suggesting that neither the test alone can reliably replace the biopsy-based diagnosis. Agreement between rapid urease test and IgG serology. The agreement analysis included 214 patients with definitive serology result. 54 patients were positive by both rapid urease test and IgG serology, while 75 were negative by both. Discordant results were observed in 85 patients, including 59 who were RUT positive but IgG negative, and 26 who were RUT negative but IgG positive. Overall concordance of 60.3%, demonstrating substantial disagreement between the two non-histologic tests. Nearly 40% of the patients showed discordant result between RUT and IgG serology. Comprehensive and endoscopic spectrum. Among 219 patients, antral gastritis was the most common endoscopic finding seen in 41 patients, followed by antral gastritis in 25, and reflex-related abnormalities were also seen, while only 6 patients represented with normal endoscopy. This findings highlighted the predominance of antral pathology in symptomatic patients. Discussion: H. pylori diagnostic discussion. Our study demonstrated a high prevalence of biopsy-proven H. pylori infection in symptomatic patient. Rapid urease test showed greater sensitivity, whereas serology demonstrated higher specificity. However, both modalities achieved only moderate diagnostic accuracy and fair agreement with histopathology. These findings likely reflect real-world factors such as proton pump inhibitor use and sampling variability. Therefore, histopathology continues to play an important role, particularly when accurate diagnosis and mucosal assessments are required. Strength limitations and future directions. The study's strength includes the direct comparison of 3 diagnostic modalities within the same clinical encounter and its reflection of routine practice in a high prevalence setting. However, interpretation should consider the single center design, potential effects of PPI exposure, and the absence of urea breath testing and stool antigen testing. Future prospective studies with standardized testing protocols are needed to optimize the diagnostic strategies. Conclusion. In conclusion, the biopsy-proven H. pylori was present in more than half of the symptomatic patient. Although rapid Urease test and IgG serology remains useful diagnostic tools, both demonstrate only fair agreement with histopathology and moderate overall accuracy. Rapid Urease test was more sensitive, while serology was more specific. These findings suggest that neither modality should be used in isolation to identify the active infection, and diagnostic discussion should incorporate histopathological, clinical, and endoscopic information whenever it is possible. Thank you. If you have any question, please do ask.